still in need of help to recover from last year's floods, both financially but also from a mental health perspective. But a vital funding stream for mental health services for those affected by floods is due to end in June. It's a worry. Let's find out more from one of those groups that's been providing this mental health support, Mind Australia. Rebecca Matheson Omondi is their mental health and wellbeing hub service manager and joins you now. A very warm welcome.
Thanks very much. Thanks for having me in this morning.
First of all, tell us what you've been doing around our region with this mental health support. What's that support look like?
Yeah, so we've had a team of mental health practitioners across the region in Loddon, working with Loddon Shire and also with the Campaspe Shire and the R Recovery Centre. So we've had people on the ground from the beginning in October right through until, up until today and through till June 30th. And we're really delivering some practical support for people, being a shoulder and ear, connecting people to GP, to recovery services, linking them in with their insurance claims. And most importantly, we've been delivering some community activities, putting a bit of fun back in, connecting people, starting conversations in the community about recovery.
And this is right across the shires. Where have you been based?
Yeah, we've got people on the ground at Elmore Village a couple of days a week. We're based in Rochester on the ground. People would know us now. We're around in the cafe, at the bakery and at R Recovery Centre. We're also in the Loddon Shire, working in Bridgewater and Boort.
Okay, yes, there's that Bridgewater railway station space.
That's correct, yes. We've been there providing outreach, just having a yarn with the locals, and now we're starting to work with the Loddon Shire to do home visits to see what kind of support people in the community need now that we're a few months into recovery.
What are people needing at the moment, are you finding? What are people struggling with the most now?
Yeah, financial difficulties, being displaced, so still being homeless, with, some timelines coming up that need to be met. Domestic violence has been on the increase right across the region, so we've been supporting people to connect with, domestic violence services. And the big one is really just having someone to talk to and someone to listen and connect them in where they need to be connected.
Well, that's the thing, isn't it? Providing that face-to-face mental health support. How important is it to maintain that face-to-face contact for people who are struggling in regional areas?
Yeah, well, we've really built up trust and rapport and strong relationships in the community now. We're really embedded. And we believe, ongoing, that this kind of support is really important for people. We know that the recovery is not just over in June. It'll be years of recovery for many families in the region.
And that's the thing, you already mentioned domestic violence. There are flow-on effects, aren't there, to the community and in the community when mental health help is not freely available?
Absolutely. There's a lot of pressure in the community at the moment, just financial burden and stress. On top of that, we now have people who are displaced as a result of the floods, and we have seen an increase in substance use, drug and alcohol, and domestic violence, and we're definitely there supporting people to access professional services and to show them that there is a road to recovery and a place where they can get support.
Yeah, wow, big issue, isn't it? And that domestic violence one, often behind closed doors, excessive drinking as well, but can have a real impact. We don't want people to be going through any type of trauma. If they can get help, they should be getting help. Even suicide as well. I mean, I hate to mention that, but let's face it, this is something, this big flood event from last October could be breaking point and could have been breaking point for many.
Absolutely. We have quite a few people who are accessing our services that have had thoughts of harming themselves or suicide, and there have been suicides across the region, which has deeply impacted, right across the community.
Is it people who are isolated, who are mainly in trouble here? Is it people who are in insurance limbo, or could it be anyone?
It's a range of people. As we know, services have been very slow to come back online locally because of the damage done to businesses and services. So it's anyone. We're seeing our elderly who are quite vulnerable in the community and not wanting to reach out and access services. We're seeing your local community, Joe blogs in the community who doesn't know where to go to get help, who is isolated, doesn't know what's available, and quite disconnected because the town's not fully functional yet, up and running, and people are not really connecting, having those safe conversations.
Yeah, wow. What happens if your funding runs out on June 30?
Yeah, we've had we're in discussions with the state government at the moment, and we are hopeful that our funding will continue. But if it doesn't, we believe it will leave a significant gap in the community for people who won't know how to access services, won't have someone to talk to, may not reach out for help around some of the key issues that we're seeing on the ground.
So this is funding specifically for those mental wellbeing community hubs set up by the Victorian government after the floods?
Exactly right. We received surge funding. The government invested $1.5 million up till June 30th to support people directly in the communities on the ground in Rochester, Elmore, Bridgewater and Bort.
Okay, so it was surge funding, specific funding in response to the major flooding in Victoria last year. But you say, and it is clear that that support needs to be ongoing further past June.
Absolutely. Partners in recovery are talking about we could be working with communities for up to 2 years. It's really important that we show the community that we are invested in ongoing support.
Member for Northern Victoria, Gail Broad, was in Parliament last week asking the state government for more mental health services in Rochester specifically. So you've got support there. Who else is behind you?
We have the Deputy Premier who popped into the hubs in Bendigo to have a chat with our team there and get a better understanding of the work that we're doing on the ground.
It's Jacinta Allen?
That's correct, yes. And we have the Shire of Loddon and the Shire of Campaspe doing quite a bit of advocacy at high levels with the Department of Health to ensure that we have ongoing funding to support those local communities.
And I understand those shires have also been really... vital in identifying people who might need your help as well?
Absolutely. They've been key in connecting us to people who are vulnerable and needing support.
So you find you're working well with the councils?
Really closely with the councils and all the local partners on the ground, particularly RRR Recovery Service. We've been providing, food relief, outreach support and being connected to people who are presenting every day in distress.
We're talking this morning to Rebecca Matheson Omondi, who's from Mind Australia. Now, you've done community events already. What have you got planned in Rochester and Elmore coming up?
Yeah, we're doing an art and journaling workshop that's running for 6 weeks. We've got a movie night coming up at Elmore Village and a range of other community events. If anyone would like more information, they can call 1300 286 463 or they can have a look on our website at mindaustralia.org.au.
Thanks for joining us this morning.
Thanks very much for having me.
mindaustralia.org.au is the website, and if this chat has raised any issues for you, you can call Lifeline. 13 11 14 is the phone number, 13 11 14. There's Beyond Blue as well for mental health support. You can go to their website, or their phone number is 1300 22 4636. That's 1300 22 4636. And there's also the Domestic and Family Violence Helpline. So I'm going to give out that number as well. They're available to talk and provide advice. 1800 015 188 is the number for domestic and family violence support. 1800 015 188. Do seek help if you need to.